are in this last counseling you have come. Now you are behind the present your friends. Okay. Now what you have to do is this. You have to practicals. You have to cover up the work done. Now they are going into exams. You will definitely come for the exams. Enroll and see what is the system running. We won't be killing you. Or you have to remove that fear that how it is being conducted, these latecomers. So we will get all cooperation from our Department of Anatomy. Avinash kothay, take it. Now our here Avinash is here. He's a good person. Everyone is a good person. You are a good person also. Now you have to make a list. See just now what are the syllabus for histology. Now you take it on your phone and go home and you settle. You tell your friends, share with your that latecomers. You see what work has been done. That will be, you see, half of your time, say 1.5 hours or 1 hour, you say. 1 hour, half hour you dedicate to your histology slides and half hour the bones or soft part, whatever it is. Now, Avinash, এদের প্রায় 5 জন না 6 জন দেরিতে এসছে, লাস্ট কাউন্সিলিং এ এসছে, তো ওদেরকে বললাম যে তুই একটু হিস্টোলজি একটা খাতা দেখিয়ে দিবি, কোর্স সিলেবাসটা ফটো তুলে নেবে। তারপরে সামনে the thoracic cage, today we will be discussing the thoracic cage revision. It's a revision class. Whenever you study the thoracic cage, you please sit and study in front of the skeleton. You can come in the dissection hall when it is permitted, time hours, and you are not entangled with other subject like physiology, biochemistry, or this thing. So you please come, please come. One thing I tell you, whatever when you're going to sit for the exam, okay, ঠিক হবে. Now you have to know soft part, your viscera, your bones, everything. Now today when you are revising a thoracic cage, you are in the having an atlas, boi. One is the atlas and your textbook. Whatever you're feeling comfortable, you have that picture. But when you come to the class, you please correlate with the bones, that bones are there with the skeleton itself. Now how it is oriented, how it is having relations, and how it is accommodating the vessels and the lungs and the heart. Okay. Now, how many ribs are there? 12. 12 pairs of ribs. Pairs. Okay. Pairs. Double. Right, left. Now, see, these the vertebra. The vertebra. How many thoracic vertebrae are there? 12. Now, what is the difference between thoracic and your cervical and your lumbar vertebra? One identification. No, foramen is a common feature for all the ribs. All the vertebra. The main thing is your rib is articulating with the vertebra, thoracic vertebra, I'm saying. So it will have a facet. Canal, the neural canal that transmits the from your spinal cord. And each vertebra is articulating with the vertebra above and the vertebra below. Okay. These thoracic vertebra now if you are given this, okay, now you will see this is the axis, the first atlas and axis, first, second, third, fourth, fifth, sixth. Now you are having foramina. You are having the foramina to pass the spinal cord. Now that goes. Now slowly you will see when you come to the first vertebra, see the impression for the ribs, the head of the rib. Okay. Now see, this is the impression. It will come like this. You just turn. See. Now you see this articulating with the vertebra like this, and that process, this facet, this transverse process. Hello, this spine posteriorly. See, পরপর দেখো এখানে ভার্টিব্রাল কোনো রিব নেই। That is one known as the cervical rib. Cervical vertebra having a lateral projection, and sometimes it is large also before the first rib, and it compasses the nerves, and you have a pain. Any pain, neck pain or anything, you ask for an X-ray or radiograph, epilateral, to see if there is a extra vertebra. This is one thing. You call the facets for the vertebra. It articulates with the rib. Okay. Now see. This is the costal group of the rib. This is the costal group. Now you see it is coming like this. The costal, the nerves are coming, nerves, vessels, vein, artery, nerve. Okay? You have to correlate and study like this. You please, I've given you a bones over here, and you take a chair, four of you, आज के खत्म करो इसको. Typical vertebra, typical cervical vertebra, then your thoracic vertebra, then the ribs, typical rib, then floating ribs. This is the first rib. These are the floating ribs. Now this is the sternum. Okay. Now this is the now see, this is the manubrum. The two facets, the clavicular notch and the first rib. Costal notches. Now suprasternal notch. You have a suprasternal notch in the manubral sternum. Now see, first, second, third, fourth, fifth, sixth, seventh. Yeah. These are the now seventh rib. Now the other five ribs. Now they form here. These are the costochondral. This is costa means rib, and this is cartilaginous. The costochondral junctions. Now you see, sit down. You have any problem, you come and tell me. It's easy. This portion is easy. You just have to read. और ऑनलाइन ऑनलाइन नहीं देखो, इधर देखेंगे. ऑनलाइन करो, आपका जो इच्छा है, मर्जी है, but you have to see it like this. And examiner you have to show. और हैरो मैरो कौन है ऑनलाइन? मैरो, बोन मैरो. ना, you are registered in मैरो. অনলাইনে রেজিস্টার করেছিস?
মানে আমার দিদির কাছে ট্যাবের ওটা ম্যারোটা আছে, ওখানে দেখি আর কি.
তো দিদি এখানেই ভর্তি আছে?
না না, আমার দিদি নিট পিজি দেবে এবার.
হ্যাঁ,
নিট পিজি.
ওকে, এটা তুমি যাই থাকো, তোমাকে আমি জিজ্ঞেস করলাম, এক্সামিনার জিজ্ঞেস করলো, হোয়াট ইজ দিস, হোয়াট ইজ দিস, ইউ হ্যাভ টু আনসার অন দি স্পট. তখন তোমার হ্যারো ম্যারো হয়ে যাবে. হ্যাঁ, আই এম নট ডিসকারেজিং, বাট ওয়ান থিং আই টেল ইউ, the classes we are taking, you must focus on that, and then in the night you do Netflix or Harrow Barrow, you go. You see a blue film, you are go. Whatever it is. But your studies will be reflected on the table. Don't be so much confident. The Harrow Barrow, this is a group of people who are encouraging this. So your network is not there. One router I have attached on this next room. My room is the third room, study room. The router doesn't work. Then he said, Dr. Babu, arakta lagi din. Be practical minded. See, we are all old folks. Naturally, some things what we learnt, we are telling you from our great teachers. You don't be dependent on তারপরে আছে না, তখন তোমার মাথা খারাপ হবে. বরঞ্চ you come and see it here. পেজে পড়ে নাও, পড়ো দেখে নাও, দেখে এক এক করে দেখে